What's up, guys? This is Big Drew, and this is Titan Lifestyle. I'm back again every Friday at 2 p.m. I'll go over Titan events, therapy of the week, Q&A, my favorite part, and also I'll get into a topic that I usually pick out. It's sometimes health-related, sometimes just crazy topics that I pick out. First and foremost, we want to see who's on. First and foremost, give a shout-out. I got a lot of people on my live. I'm going to get the main screen up in just a second. What's the weather like where you're at? I know we'll have a huge cold front coming in. A lot of people around the country are complaining about the cold. We're complaining here too in Florida, but our cold is not like other people's cold. Our cold is still manageable. As you guys can see, I'm gonna cut off today. So if I could be outside in the cutoff, it's not that bad yet. But next week is supposed to be miserable. So you guys know, anytime it drops below 75, I'm in the house. I hate cold weather. I hate anything below probably 80, so I'll be happy when that weather hits 75. Shout out to the Punisher 80 is on here. I see they just jumped on. I'm going to give a second just so everybody could jump on, give some shout outs. We have a weight loss special this week, so tune in for that. Our therapy of the week is like a big special from numerous different things you can get. So normally our therapy of the week, actually let's just jump into our therapy of the week. This week's therapy of the week is a weight loss special. 10% off of any of our weight loss therapies. So you get 10% off ECA, you get 10% off semaglutide, you can get 10% off AOD 9604, terzepeptide, the fat-burning creams, Titan Complete. Titan Complete does count as weight loss. I know a lot of times, I've said it in the past, it's kind of like my all-in-one vitamin amino, but it does have carnitine and stuff like that in it, so it is considered weight loss. So basically, semaglutide, ECA Stack Plus, Titan Cream, terzepeptide, AOD 9604, L-carnitine, Titan Complete, Prometheus, and also the fat-burning cream. So any of those, you can get 10% off. I would take advantage. I'd probably get terzepeptide or semaglutide. Semaglutide's $550 for 10 weeks, so you think 10% off of that, you're going to get a good chunk. Or terzepeptide, $650 for 10 weeks. So 10% off that, you're going to get even more. So take advantage. The sale ends on the 3rd, which is today. So you definitely want to jump on this sale. If you order online, just type in the discount code. It's just weight loss, all one word. That's the discount code, and that will get you the 10% off. So, yeah, today's the last day. I'm not sure if it's 6 p.m. or 12 midnight. We're on Eastern time here at Titan, so I would try to get in there. Try to jump on the phone or do what you have to do to order that to get the discount before 6 p.m. Eastern time, just to be safe. If not, call 727-389-3220, or you could text that number and just ask them, how late can it be, or does it have to be before 12 midnight? Because the date is 1/3/25. I can't believe we're saying 25 is the last day. Shout out to Veronica Love. Shout out to Caden, Carl, John, LG, Obvious Disguise, CTD also just joined. Get your questions ready. I got my thinking caps on. First one, thought it was CT Fletcher. Yeah, I get that a lot. A lot. The only thing I get more than CT Fletcher is Kimbo Slice. Before I grew my beard out, no one ever said Kimbo or CT. But as soon as I grew my beard out, everyone was like Kimbo and CT. So I've actually met CT a bunch of times, taking pictures with him. So every once in a while, I'll throw a picture up that just says, like for those who I think I look like, for people who actually think I'm CT. CT's a great guy. A lot of motivation came from him. Yeah, he kept me going. I like his earlier videos when he first started getting going. Now he's in them. He still does his thing now, but I like the old school gritty CT. He's still gritty, he's still CT, but that was pretty much my motivation before I even had social media, watching his videos and getting crazy with it. So shout out to CT Fletcher. Also got Nas on here as well. Nas 1234s. Shout out to them as well. Get your thinking caps. I got my thinking cap on actually, so let's get these questions going. Titan events. We do have some Titan events coming up. I believe we have I'm gonna have Brian pulled up real quick. And if you guys or girls have any questions about events or even questions about the topic as I'm answering someone else's, just type it up. It comes across one of the screens in front of me. I'll get to it as soon as I can. I know a lot of times I'll be jumping back and forth from questions to events. I'm kind of all over the place sometimes, but just be patient. I'll get to that. First question, what's your regimen or cycle? For people that don't know what a cycle is usually it's usually in reference to a concoction of things are taken for amount of time. Some guys will say testosterone is a cycle. Some guys will say, PEDs or peptides, or basically it means like you're running specific things for a certain amount of time. Right now, I'm just doing my Titan things. I'm doing my TRT basically, and a lot of food. A lot of food. It's actually becoming overwhelming the amount of food I'm having to eat right now, because you guys know I've always been lean, eat lean. I'm still eating clean, but the amount of food I'm eating, I'm basically eating almost all day. And I'm taking less time off of the gym because I'm doing my kind of like a winter bulk. Still want to keep it tight, but a winter bulk. But my cycle right now is basically just Titan stuff. Nothing crazy, no growth hormone and nothing crazy like that. Just keep it simple. And again, a lot of food and a lot of rest. More rest I'm getting, the better I feel in the gym. And that's how I could get more size as well, the rest less. I have a fast metabolism, so if I go to the gym every single day, I have to eat even more food. And then I start doing cheat meals to get my calories, and it's a mess. So now I train maybe 3 times a week, which is crazy because I used to go 7. But I feel like those 3 days I could really go hard, and the other 4 days I can kind of recover and just pound the food. How many calories per day? Tundra's asking. I basically just try to get as many as I can. I'm not really tracking my calories. I mean, I'm looking at everything to make sure I'm getting calories in, but I'm basically just getting as much calories as I am. I'm not really a bagel type person. A lot of my clients, I really don't even recommend bagels to them, but I'm going to be honest. I've been eating a lot of bagels lately because bagels 250 calories per bagel. So I figure if I eat 4 to 8 bagels throughout the day in between meals or snacks, I'm getting another 1,000 to 1,500 calories, and I'm getting another, 300 to 400 carbs. So my meals are simple, my calories are high, my carbs are high, and my cycle is simple. Just a lot of food and a lot of rest, which sucks taking time off from the gym, because I like to go every day. But sometimes less is more. Just like on my screensaver, my phone says less is more. I have to remind myself sometimes. That's why I put it there. Shout out to Jay Oliver. Anybody else on here asking questions? Shout out to Strawberry Kisses as well. They just joined. But yeah, I was talking about the weight loss therapy, the 10% off of the therapies. Anybody's trying to lose weight, I'm just give you a breakdown of, they're all fat burning or weight loss therapies, but just to give you an idea of which is strong and which is, how they work. The fat burning cream is basically a topical cream that you would rub on. It actually burns fat. It doesn't just, burn or, give you a burning sensation on your skin. It actually burns fat, and it actually tightens your skin as well. What's good about this special with this weight loss cream is a lot of times people have fat loss burning creams or fat burn creams, but they irritate the skin because the niacin or has other stuff in there. It gives it a burning effect, but it's not actually burning fat. So you wouldn't be able to put those things other places, sensitive areas. With our fat burning cream, it's sensitive enough where you could put it underneath your eyes. If you have bags underneath your eyes, you could put it on your neck. If you have creases on your neck, older people get creases on your neck. If you did a lot of weight loss or you had a lot of weight loss and you have loose skin, you need to tighten that up. It'll do that as well. If you're dieting for a show, in the final weeks when you're pulling water and your skin gets kind of loose, even though you're lean, there's no fat, your skin is kind of loose because the water reduction happens so fast, you may get loose skin back there or skin folds. This will definitely help with that. I used it in my last show with a little bit of skin folds in my lower back because the skin, I was just no water back there and the skin was folding. So that's the fat burning cream. Terzapeptide. Everyone knows semaglutide. It's a weight loss injectable that pretty much the world knows about now. So I'll talk about terzapeptide. That's actually stronger than semaglutide. It actually burns fat a little bit more, a little bit faster, a little bit better, so to speak. And you're not going to get any type of nauseous feelings that some of our patients get with semaglutide. Terzapeptide's a 10-week cycle. Our 10-week run or stack, 10 weeks is 650. But again, with this 10% off, jump on that today. You could take advantage of that. ECA Stack Plus, that's what I use. That's what I would take before I work out. It's ephedra, caffeine, aspirin, B12. And it's all in a capsule, so there's no injections. It has 200 milligrams of caffeine, which is about the standard energy drink that you'd buy at a gas station in the cans. It's about similar amount, but it's a lot cleaner caffeine, no additives. And the aspirin is going to thin your blood out. So you get the fat burning effect with the blood thinning of the pump, and then the caffeine gives you the energy. That's what you would take, before you work out or when you need energy, or just for overall fat burn. AOD 9604. That again, it could be injectable or capsule. And AOD 9604 is just a capsule that actually burns fat. It's not going to give you the stimulant energy that the ECA does, but it's actually it's clinically known to actually burn fat, not just give you energy, not just suppress your appetite. You will actually burn fat. And you could take ECA Stack Plus and AOD 9604 together. Again, AOD is non-stim, ECAC is stim, so you could take those together. So whenever you're calling and you're asking about these different therapies, if you want to take advantage of the 10%, make sure you ask the medical provider you're speaking to or just whoever's on the phone to get knowledge of if you could take two different things together. A lot of times people say they take advantage of 10%, so they'll get like 5 different things and they'll take them all at once. Sometimes that's not the safest thing to do. So just make sure you can take these things combined, and it's always ask questions. The more you can ask, the better. And again, you don't actually have to call and go through the automated system and all that. You could just text the number 727-389-3220 and ask any questions that you may have if you're a patient, and then they'll get right back to you as well. Someone said gasoline tightens the skin too. Yeah, it does, but it'll tear your skin up. Cold air burns fat. Cold air doesn't necessarily burn fat, but when you're freezing cold and you shiver, the shivering is actually, you're burning calories because your body is actually like shivering. So just that tightness and you're shivering, that actually burns calories, not specifically the cold. Anybody else have any questions on here? I'm 40 years old. Should I try TRT to help with gains? Yeah, it could definitely help with gains. It's not just about gains in terms of muscle building when people are taking TRT. I mean, that's what, I'm not going to lie, that's what a lot of guys, bodybuilders, they want to take it to get better recovery and all that, better sex drive. But it's going to help with a lot of other things too. It's going to make you feel younger. If your test is low, it's going to help with recovery. And also, yeah, it's going to help with the gains too. So 40 years old is a perfect time to get your blood work done. Again, everything's going to go off of your blood work. I can't answer that question. You should try it if your test is low. Some people at 40 years old, their testosterone is optimal level. It's already at a 900, so pretty much we don't need to do anything at that point. You're already at the level we're trying to get you to. But if you come in and you get your blood work done and say it's in the 100, 200, 300s, chances are, that's pretty much says, I'm not a doctor. I can't prescribe it or say definitely, but at that point, you're pretty much going to get prescribed testosterone, and then you're going to feel a lot better. But gains, yeah, it's going to help with gains, muscle gains. It's going to help with sex drive. It's going to help with recovery. It's going to help with your overall sense of well-being. A lot of people don't talk about that when you're taking testosterone. When your test is high, you're just in a better mood. You have a better sense of well-being. So yeah, it's going to help all over. Jarrell Swade says, explain less is more. Just got in here. I believe when I was saying less is more, I was talking about recovery and going to the gym. I want to go every single day, but if you want to grow, you have to eat and recover and, grow. So right now I only train maybe 3, maybe 4 times a week when I used to go 7, and I'm getting better results. My joints feel better. And I look forward to going to the gym, whereas if you go every day, it's kind of like, oh, well, I'll just shut it down and come back tomorrow. When you go every 2 days, there is no tomorrow. So you go hard, and right before you're about to leave, you say, wait a minute, I can't come back. That's what I was like yesterday. Yesterday, I was training in the gym, and I was about to shut it down. And I said, wait a minute, I'm taking the next 2 days off. So I stayed for another hour. So I feel a lot better that way. Any other questions? Andrew just jumped on here. Andrew726. WP Can just joined. Jay Oliver as well. How many calories per day? I already got that. Greetings, strawberry kisses. Florida fish hooker. As a female athlete thinking of switching from pellets to injections, thoughts? Very good idea. Pellets, I'm not going to say they won't. And what she means by pellets, she's talking about testosterone. Some places where they'll actually inject and pellet into your glute, deep into your glute. And it's not done bi-weekly or month, or it's not done every week or so. I think it's every few weeks. Different places do it different ways, but basically, yeah, she's asking if the pellets, how does it compare to the injections? With the pellets, first of all, injection is just an oil-based, usually an oil-based testosterone. It's injected intramuscular right into the muscle. Usually 1 inch or 1.5 inches, depending on how big the person is, or how big their glute is, their muscle glute, their gluteus muscle. And that what that does is it's injected oil-based, so you have to inject once every week or every bi-weekly, which is 2 weeks. Some people do it twice a week, depending on how much you get. The difference with the pellets is the pellet's going to be basically embedded into your muscle, and you can't tell how quick it's going to absorb or dissolve, because the injection frequency is so rare, maybe once a month, or I'm not sure how they do it, 5 or 6 weeks I've heard, where first of all, it's going to knot up. You're going to have a lump in your glute. You don't know how quick it's going to disperse. Your muscle may be tougher than the next person, so when I take it, the pellet might take longer to absorb, so your levels may be off. I believe in keeping your blood levels stable when you're on TRT or HRT. I wouldn't want to have a spike from taking a pellet for the first week and then have it taper off. When your blood levels aren't stable, that's when you could have side effects. That's when you could have mood swings. Estrogen could fluctuate. Another thing too with the injections, I've heard that they hurt. Professional basketball player, very well-known basketball player, actually played with Shaq. Spoke to him last year about it, and he said he had gotten the pellets done, and with the pellets, he said his whole right side of his glute, or I'm not sure if it was right or left, but his whole side was swollen for weeks. It was a knot, and it was painful, and he didn't really get the consistent libido, the consistent recovery, the consistent levels that he'd got. I've heard nothing but bad news about the pellets. I haven't heard anybody that's taken the pellets that is also taking the injections that says the pellets are better. So I mean, I've never done the pellets, so I can't tell you how it feels, but I would never recommend the pellets. And then she's also saying that her coach thinks pellets causing her to hold more water weight. So what's the thought? Yeah, exactly what I said. Like, your estrogen is going to be, when your blood levels get unstable, your estrogen goes up and down. If your estrogen spikes, that's going to have you water weight, water retention. It's going to make men, it could have you have, puffy or watery nipples, sensitive nipples. That's from estrogen fluctuating. And you're going to have a slew of side effects. I've heard when people take the pellets, it's kind of like comparable when your hormones, or a woman's going through her menstrual cycle where her hormones are off and she's more emotional. Pellets can do the same thing. Out of nowhere, you'll just be like, oh, my testosterone is off today, and you'll start feeling weird. I've heard people say that specifically. So, I mean, and not only that, too, if you're taking the pellet, you don't know exactly how much you're getting, because you don't know when it fully dissolves and the highest level absorbency when it's dissolving. If you do an injection of testosterone cypionate, if you do a twice a week injection, say Monday and Thursday, after the second or third week, your blood levels are going to be stable throughout, where it's not going to spike like that. So I would definitely say go injections over pellets any day of the week. The only day I would say to go pellets over injections, if there was some medical reason, I can't even think of one, but I always think of worst case. If there was some medical reason where you couldn't do a testosterone injection, intramuscular, I'm not sure why that would happen, then maybe, but again, yeah, injections all day, every day. Any other questions on here? One of my topics today is actually, people are talking about less is more. This doesn't really have to go with less is more. You're welcome, Florida fish hooker, you're welcome. One of my topics today is meat substitutes linked 42% higher depression risks than regular vegetarians. So, someone's asking, okay, just making sure I don't have any questions on here. Yeah, so basically meat substitutes, and I'm not saying vegetarians are bad. This is not about anti-vegetarian. This is about anti-fake food. So new research found that vegetarians who ate plant-based meat alternatives, not just plants, plant-based meat alternatives had a 42% higher risk of depression as well as signs as greater inflammation. So once again, they say not to eat processed foods and this and that, but I've heard or I've even seen people where they're saying don't eat bad food and don't eat processed food, but they're eating fake meat, which is processed meat. So that's a whole nother show. But basically, this stuff is bad. Just because it's supposed to be healthier, it says. And what's the problem with meat, anyways? I mean, if you're a vegetarian, that's one thing, but a lot of times people aren't even vegetarians, and they still automatically think that meat is bad. I noticed that the healthiest people, whether they're visibly the most healthy or most healthy on paper, eat the most meat and the most veggies and the most regular food like rice or potatoes and, regular stuff like that. But yeah, it's saying that 42% higher risk of depression is almost half. So you think out of 100 people, that's 42 people are higher risk of depression from eating fake meat. Now, if you want to eat vegetables, eat vegetables. If you want to get a whole bunch of vegetables and grind them up into a paste and make a patty that's real vegetables and cook that like it's meat, that's fine. I know people are doing specific type of mushroom that if you cook it the right way, it tastes like chicken or fried chicken. That's fine because it's an actual mushroom. But actual fake, not even real food processed, I don't think there'll ever be a food that can be processed that is as healthy or healthier than the real thing. If you look at across the board, I mean, in this country, it's really bad. So other countries probably can't even fathom what this stuff is. But if you look at across the board, I've never seen something that's processed, whether it's liquid or whether it's something you eat, a solid. I've never seen anything actually be healthier, ever. So, I mean, that's just one thing to think. And also, too, when you're looking at people that eat these foods, look at the person. Don't just look at the information that's coming out of their head, because a lot of times people, they don't practice what they preach. So they could talk a lot, but, just like they said, well done is better than well said. So a lot of times I'm listening to someone about health advice, I look at this person if they're healthy. I look at if they were healthy. A lot of times if I'm listening to someone about financial advice, I'm not going to listen to someone that's broke right now. They used to have money. So I'm not going to listen to someone who's out of shape right now who used to be in shape. That's one thing too. What foods are we talking about? Right now I'm talking about meat substitutes. So basically plant-based artificial meats, basically fake meat substitutes, and how they're linking people to 42% higher risk of depressions. The alternatives is the fake meat. Like it's basically meatless, but they'll make a burger or make steak or something out of it. Like stuff you're like, oh, this tastes like meat. What is it? And they tell you it's something else. Yeah. But overall, eating plant-based meat alternatives didn't have any health risks for vegetarians. So if it doesn't have any extra health risks, then why not? If it doesn't have extra health risks, then why not just eat the actual thing? Why not just? It doesn't make sense. Like, if it's more healthy, yes. If the thing you're eating is more unhealthy, yes. But if it's not, it really doesn't make any sense. And they're saying this because it's a concern of environmental impacts over meat consumption grows. More consumers are switching to plant-based meat alternatives. I think it's just another fad. I think it's just a particular thing where, it's kind of like the keto and the Atkins diet, and they have all these things that come around. Hopefully it goes. Hopefully with the new restrictions on food dyes and artificial sweeteners, that'll help a lot of the, hopefully that crosses over to a lot of the other artificial things. But hopefully this country gets it together. Otherwise, we're going to continue to be the most powerful country that's the sickest all the time. It makes no sense at all. Big Vic, sub-Q injection versus intramuscular. I'm always going to go intramuscular, always intramuscular. The reason why I specifically don't go sub-Q is because I'm real lean and I don't really have any fat in my stomach. So I don't like, when I do sub-Q, I feel like it's almost like a pimple. It's just sitting on top of like one of my abs. It's just sitting there and I have to like rub it in. So And in terms of blood work and testing and how the things are working, whether it's IGF-1 or whether it's a peptide, whether it's BPC 157, I always go IM. That's just the way I've always done things. Chandler B, do I need to take a gram of test a week to achieve your physical image? No, absolutely not. That would be 4 times or 5 times too much. What you'd have to do is get your diet on point. You can maybe do 200 a week if you qualify for HRT, and then if you want to get big like that, I'll jump on some MK677. Like I say this almost once a week. MK677 will get you bigger and faster, quicker than almost anything I've taken. I'm talking over the counter, under the counter. It doesn't matter. MK677 works. So if you guys want to get big, rather than do a gram, which is 1,000 milligrams of test a week, which is 5 times more than a TRT dose, I would just say do a TRT dose. If you qualify, 200 mgs a week, MK677, eat like crazy, train like crazy, and rest like crazy. Always want to rest. Also, you could use enclomiphene while you're, well, I mean, I'm not a medical provider, so, but my HRT regimen, it's enclomiphene while you're taking your tests. In other words, so that way you wouldn't have to do, you wouldn't have to do 1,000 milligrams, which is way too, 1,000 milligrams should last you 5 weeks. So, I mean, that's way too much. MK677 is a pill. It's a capsule, very easy to take. Take 1 capsule in the morning. It's going to help you eat all day long. Or if you don't want to eat too much, just take it at night. Someone said everyone is on Ozempic this winter. Easy to get in Tijuana over the border. Yeah, I'm not sure what's going on over the borders and the pharmacies over there, but yeah, everyone seems like is jumping on Ozempic right now, which is semaglutide. It's not actual. That name is not the name of the actual ingredient. That's just one of the companies that makes it. So if you're looking up, if you see semaglutide, that's what that is. The drug is actually called semaglutide. Someone said, what's a good fountain of youth type peptide? I would probably say tesamorelin and IGF-1. Also, NAD works well too. NAD is like very big with cognitive function, helps with your skin, hair, give it that glow. 240 milligrams for a year, want to blast and get like you. How much should I blast? You don't need to blast, man. You need to blast the food. Get some MK677. I know guys that have taken 1,000 milligrams of test a week and not even eaten or worked out and just think, I'm going to get big, and they don't even get big. Then I just tell them, look, force feed yourself the right foods at the right times, and that's how you get big. Like, if you don't look at people that work out and you look at people that just want to get bigger, they just eat more. So a lot of times people fail to just eat more. Just got to eat the right foods. Make sure you're using the bathroom. You don't want to eat a whole bunch of food and have it just building up in your stomach all day long. Someone said about how about nitric oxide? Good question. Nitric oxide is basically, I think it was referring to as just like a pump, like when you get a pump in your muscle, what he could take to get a better pump. Hercules Potion, what we have here at Titan Medical, is the best thing for that. You're going to spot inject the muscle before you train, whether it's 15, 20, 30 minutes before you train, and it's going to give you an insane pump to that specific muscle. It's systematic, so you feel it all over, but say if you put it in your biceps and go train biceps, you're going to feel it. Like you're definitely going to feel it, and you're going to see the swell on your bicep. It's basically a concoction of aminos, so it's nothing anabolic in there, but just the pump is insane. Tundra says, do you suggest protein shakes to keep up the calories? If your protein shake has calories in it, protein shake is for protein. So a lot of times people say, I need to get my calories, I'm going to drink more protein shakes. If you need to get your calories up, you should be drinking weight gainer shakes. Whether you make your own, whether it's, use peanut butter and banana and, put some oatmeal and calories in there, or you buy a quality weight gainer. There are a couple. Real food's always better. But again, if you can't afford or stomach or have time to eat 10 meals a day, which literally you'd have to do, you could do a couple weight gain shakes. Make your own, though. You could do peanut butter, banana, oatmeal, all that stuff. Egg whites. You can make your own. You're welcome. Yeah, Tundra, yeah, weight gainer. Weight gainer, just eat the right foods. Track your foods. Look at everything. Honey has a lot of calories. It's not that big volume. Peanut butter has calories, but it's not that big volume. So if you add a little bit of honey, add a little bit of peanut butter with every one of your meals, you're going to get more. How do you make your own egg whites? You don't make your own egg whites. You basically just crack them out the shell and separate the yolk, or buy them in the carton. If you buy them in the carton, those are safe to drink. They don't have to be cooked. I would never actually, you can't make egg whites, but you could scramble them. You could either drink them, put them in the blender with some oatmeal, drink them, or you could just, scramble them. Mass gains, yes. Let me see if we can pull up some of these topics, or some of these, these events coming up. Someone said, I like peanut butter, oatmeal trick. I learned from you guys in the 80s. Yes, peanut butter, 2 cups of egg whites, 2 cups of oatmeal, frozen fruit, and that's your protein shake right there. You want to add creatine, oatmeal, but whatever, that's it. Cars and Couture, 14th Annual Galler's Collection Cars and Couture. This is going to be huge. It's going to be Saturday, February 8th, 6 to 10 p.m., and it's going to be at the Motor Enclave, I believe. Let me make sure. It's going to be at the Motor Enclave, which is on Falkenberg here in Tampa, Florida. You can get tickets online. The attire is black tie. Walk the red carpet upon arrival, indulge in VIP open door bar and dinner, enjoy live music, be entertained by performers. Yeah, it's going to be great. Stunning fashion presentation, much more. It's benefiting Jacob's Touch Foundation. So if you guys want to donate to Jacob's Touch Foundation, it's a nonprofit community-based organization in Tampa Bay area dedicated to providing financial care and assistance to families, organizations supporting children on the autistic spectrum. So yes, shout out to Jacob's Touch. If you want to write the check for them, hit us up, let us know. But yeah, that's pretty much it for the show today. Make sure I don't have any more questions. I'll be back next week. If you guys want to watch this show or plenty of other shows I've done, check out Titan Medical's Facebook, Titan Medical's Instagram, Titan Medical's TikTok, and Titan Medical's YouTube. And if you're on YouTube, make sure you hit the bell so you're notified of videos like this, and also subscribe. Also, if you don't want to watch me, just listen to me on the podcast. I've done over 250 shows like this, so you can check us out on the podcast. If you have an iPhone, just go to your podcast app, type in Titan Medical Center or Lifestyle with Big Drew. If you have an Android, just Google Titan Medical or Lifestyle with Big Drew. Last one, Tundra is asking how to order MK677. Great question. Call 727-389-3220. Let them know I just talked to Drew, and he said to give you a discount on the MK677. If you don't feel like calling, you could actually text that number as well, or you could check out the website, www.titanmedicalcenter.com. You could do that as well. But Tundra, before you call, if you go on the website, Titan Medical, go to the new patient paperwork. You'll see male, female. Just fill out the paperwork and wait till that's done. That way when you call, once you call in, just be like, yeah, I talked to Drew on the live. He said I could get the discount. Here's my name. The paperwork's already done. It's going to get you in there a lot faster. A lot faster. But that's it for today. Again, call or text 727-389-3220 for any of the therapies I just mentioned. 10% off of all weight loss therapies. Today is the last day, so get that in before the end of the day to take care of that discount. I will see everybody next week. I'm Titan Lifestyle. This is Big Drew. I'm out.